Welcome back to the Self Careapist Therapist. I'm Lorraine Moorhead, therapist, clinical social worker, therapy consultant, and host, and today's episode is titled, How Learning Keeps Therapists Energized Rather Than Drained. Today we're talking about why the continuing education most of us were taught to pursue might actually be working against us in terms of our excitement, passion, and burnout, and what the research says about the type of learning that genuinely fuels therapist well-being and longevity. Be sure to stay to the end because I'll be sharing some practical ways you can audit your own CE approach and start learning in a way that actually energizes you. And if you're finding value in this series, please like, follow, and subscribe on any of your favorite podcast platforms so you never miss an episode. And I think it genuinely helps. And head to lorrainemoorhead.com/podcast to sign up for the newsletter, where we deep dive into a separate topic from the podcast every week. Most of us have two very different memories of CEs, and that's because there's the kind you did because a renewal deadline was 3 weeks away, and I get it, 3 weeks might be generous for the way that a lot of us approached it, and you found something available, sat through it, closed the tab, logged the hours, and maybe never reflected on it again. And then there's the kind that you sought out because you couldn't stop thinking about a specific clinical puzzle, a framework, or a colleague mentioned something that you've been turning over in your mind for weeks. Both count toward your license, but they are not the same experience. And the research is starting to explain exactly why. Today, we're going to get into what's actually happening when learning energizes you versus when it drains you, and what you can do with that information sometime before your next renewal cycle. Most therapists can feel the difference between the CE they chose and the CE they completed, but we haven't always known how to describe how the difference impacts us clinically. And I think it matters to explore. There is classic research on continuing education that frames this as the voluntary versus mandatory divide. And what it finds is that mandatory models tend to prioritize hours over impact. So when the CE is externally driven and the primary motivator is a deadline or a licensing requirement, the learning tends to remain theoretical and it doesn't translate into practice, which means the time investment doesn't show up as a positive in your work and it doesn't contribute to your sense of competence or growth. And why that's important is that it's not neutral. The CE doesn't transfer and was just kind of a wasted afternoon, or for some of us, middle of the night. It's actually draining because it disconnects us from two things that are core to professional well-being, which is intrinsic motivation, or the internal drive that comes with genuine curiosity and interest. And the second is professional identity, your sense of yourself as someone who's growing, developing, lifelong learning, and staying engaged with your craft. When the CE bypasses both of those things, you're left with hours that you had to log and nothing has changed, and over time that accumulates. So what I'd invite you to do right now, just as a quick internal check, is think about the last hour of education that you completed. Did you use anything from it? Did it change how you showed up in the room? And also, I'm just thinking right now about how I think about these things with my podcast. Every time I reach out to a guest to see if they want to come on, I let them know that I try to give my audience something that they can take and implement today and a path for continued study if they're listening and think, I want to learn more about this. I want to use this in my practice. I want to get trained or certified or whatever it is. So I try to think about that too, because I prefer to be in an in-depth training where I leave and can use with my clients and think about exactly what I've learned. I want to know the language. I want to know the screener. I want to know the paperwork, how to document it. I want to know the outcomes. And so generally, I find myself preferring that kind of learning for myself because it gets me so pumped and excited versus more of a theoretical orientation, like I don't just want to know the research. I want to know how to take it and apply it. And so I find for myself that usually I'm signing up at least once a year for a really in-depth training rather than even going to conferences that give a little bit of this and that, because I want to make sure I have something usable. And I try to translate that to all of you also. So, how does it feel different when you're doing that and getting something you can genuinely sink your teeth into? Because that difference right there is data. It's telling us something about the kind of learning that actually works and invigorates you. And we're going to spend the rest of the episode looking at why. So what's actually happening here is there's a gap between compliance and competence. We've built a credentialing system that measures time in the seats, not growth in the room, all the time. And I think I've seen that some states and jurisdictions have tried to find a way around that by giving a really specific thing that they want their local clinicians to become aware of and become familiar with. And we've touched on some of those over the past episodes of the year because we've talked about states that require specific suicidality CEUs, specific substance abuse CEUs, specific ethics and culture CEUs. But I think sometimes you can still circumvent that by just finding what's available in the time frame that you have and not genuinely giving something that you're interested in learning about. So having to renew and complete hours can feel like another overwhelming task when it's piled on all the other mandatory stuff we have to do as therapists, like document. So if mandatory box checking CEUs doesn't transfer, what does? And those are the actual conditions that predict whether learning makes it from a webinar or a training room into your clinical work. A 2024 qualitative systemic review of continuing professional development in health professionals, and I will link all the research that I talk about in the show notes, synthesized that factors that determine whether learning actual transfers into practice, and the findings are somewhat specific. The key factors are self-directed needs assessment, meaning you identified the learning need yourself and it wasn't assigned to you. And relevance to your current or future role, meaning it connects to something you're actually dealing with or working toward. And opportunities to apply and practice the skills, not just hear about them. So an experiential opportunity to try it on, and workplace or peer support to implement what you learned. And follow-up reflection, meaning you return to the material after the training to consolidate what you took from it. So from a personal example, someone recently asked how I find my podcast guests, like I mentioned earlier, and I realized the answer relates. When I figure out what I want to learn about and find the best person to teach it to all of us, I think the episodes are more interesting and engaging. For me, there isn't anything more fun than getting a question answered right from the horse's mouth. And that's also true for a book by an author I'm super interested in hearing from. Even if I don't necessarily know that I'll agree with their stance, sometimes I'm really interested in learning and feeling excited about reading it. So we talked about an experiential model that allows you. So hear me out. I know that role play at trainings is probably sometimes something that we as clinicians probably kind of all dread at times, but knowing that you know what to say, what to do, and you've kind of tried it on can go such a long way for you actually using it in your practice. And I would also say, like in line with the study, that knowing that you can go back to your office or your supervisor and say, this is what I learned and this is how I'm implementing it. And your supervisor can either help you implement it or you can find consultation to help you walk through challenges that you face when you're implementing it. It can be so powerful too. I tell this story a lot when I mentioned that I have been trained in EMDR a few different times, because I came back from my first EMDR training, which was around 2009. And I let my supervisor know that I was training in it and ready to use it. And she let me know that some of the populations we worked with at the time didn't yet find that they had enough research to endorse the use of it with my clients. My clients came from a specific population at that time, and they've since changed their rules. And even this population is fine with EMDR now in the present day. But all these years ago, almost 20 years, which is scary. But almost 20 years ago, the population wouldn't allow it. And so I tell this story because you can probably predict exactly what happened. I didn't use it, and I never got that familiar with it. And then I wanted to retrain in it when I moved to another population, because I think being able to use it, get supervision in the model, touch base about the things that you're finding is such an important way to bring it back with you. What I often do, and I should even show, I'll include an image of this. When I leave a training, I consolidate all my notes into prettier writing with beautiful pens. And that way I have a really clean document to reflect on. But also the research does show that writing by hand does some bilateral stimulation that allows us to program and reflect upon what we've learned in a way that even typing doesn't. Now, if you're a typist, please, by all means, whatever method works for you, use it. But I think reflecting on everything that you've learned and taking a minute or an hour just to really think through what you've learned, what you've heard, how you want to implement it, and create a bit of a game plan or a treatment plan, for those of you in the know, could really help you to take your knowledge from practical or to application, and can help keep that excitement about it. A mixed methods nursing study similarly reinforced this. And again, I'll include this link to this study with some striking numbers. When those conditions were present, when the learning was relevant, actively engaging, and supported, 88 to 89% of participants reported actual changes in their practice, not just the intention to change, actual changes in how they practiced. The common thread in both of those bodies of research is what they call learner-driven goals and perceived relevance. When you identify the need and you came to the learning with a question you actually wanted answers, you were far more likely to implement what you learned. CE transfer is really a question of ownership. The moment you move from I need hours to I have a question that I want answered, the entire relationship to the learning changes. And that's not a small shift. It changes your engagement during the training, your retention afterward, and your motivation to actually apply it. So the practical translation of all of this for therapists and clinicians is this: CEs that you chose because it matched a real clinical puzzle you're sitting with right now is different from a CE you chose for credit availability. And the research gives you permission to treat those genuinely different categories differently because they really are different. Now, I want to go one layer deeper, because understanding that interest-driven learning transfers better is useful, but I think it is even more valuable to understand the psychological mechanism behind why it feels different in your body. So when I sometimes see women postpartum in my client, or birthing people postpartum, and as they're getting back to work or trying to get back to pursuing their own interests and passions, sometimes an assignment that I will give is, before you switch gears for the day, or before you switch hats and you go from the parenting role or the parenting part that was taking the lead into a different role or part, why don't you try and learn something or study something or immerse yourself in something about that new hat that you're going to put on? So for example, if it was me And I was going from staying at home with a small child to, in the same day, putting my therapist hat on. What I might challenge myself to do if I was taking this feedback would be to listen to a podcast on this subject. And I have just the one for me. Just kidding. But I could also read a chapter or two of a book that on a topic that I'm trying to pursue, learning more about. Or I might be able to pull up a YouTube video about a topic that I want to learn more about in order to excite my brainwaves into the gear switch that I'm about to make. So this could also translate to anybody switching hats, going from even learning or something therapy related into something else that they're excited about or passionate about, but they could just dial into something that they want to learn in order to start to turn on the brain to think about that topic. So for some people, it might be doing a small dose of learning before they go into the office, because it really starts to get us curious and excited about the work that we're doing. So the question really is, why does curiosity-driven learning feel energizing while compliance-driven learning can feel depleting? And there's actually research to answer that. Todd Kashdan is a psychologist who has spent much of his career studying curiosity as a psychological state and trait, and his framework is worth understanding because it reframes curiosity from a personality element into a functional protective factor. He conceptualizes curiosity as a positive emotional motivation system. It's not just a feeling, it's a system that actively drives approach, behavior, engagement, and a genuine pull toward novel and challenging experiences. When your curiosity is activated, you move toward difficulty rather than away from it. You engage rather than retreating, and you engage rather than just enduring too. And in his research, individuals high in curiosity showed more engagement, more positive interpersonal outcomes, and greater feelings of connection, even in ordinary or unremarkable contexts. Curiosity, by his framework, is generative, which means it creates more of what you're looking for. I had a conversation just like this that I think landed on the importance of curiosity recently in a clinical supervision meeting. We were talking about self-motivating and finding opportunities to do more in the workplace. And I think it comes down to curiosity. I had such an insightful comment from a few different supervisees, and they were saying that what takes them from just doing the basic elements of the task versus seeing it through and finding creative approaches to conclude the task, in a lot of cases, is mindset. Like switching their mindset from what am I required to do into, okay, how can I either take a creative approach to solving this, which sounds a lot like curiosity, or like what could I gain by approaching this in a beginning and seeing it through sort of mindset. So I think it's just interesting to think about curiosity in that way. Going back to Kashdan's work, he's connected what he calls joyous exploration, a specific dimension of curiosity characterized by genuine delight in learning and discovery, to lower burnout and higher engagement, specifically in therapists and psychoanalysts. That's a direct line from curiosity to burnout protection in our specific population of colleagues. Curiosity isn't just a personality trait that some therapists are lucky enough to have. It's a state that can be activated or suppressed depending on the conditions you create for your own learning. When you choose CEs that activate genuine interest, you're not just picking a better topic, you're activating a psychological system that is itself a protective factor against burnout. That's why some topics can feel completely different depending on whether you chose it or required to complete it, to go back to the state mandates and look at them in a different light than I was talking about earlier. And the content isn't the only variable. The conditions of the learning, what drove it, why, and what questions it's answering shape the psychological experience of it in ways that have real clinical consequences. So, like I was saying earlier, for me, that's going from practical to actual application and knowing that I can take it and lead with it in my sessions. That's what feels really exciting to me. I remember early on just doing a lot of learning and understanding kind of like, oh, why does that happen? And what is like, how does that affect people? But really taking that knowledge into like the curiosity and the creativity of like, now how do I take that knowledge and package it up so it can actually help people? That is the link that was missing for me in a lot of my early training, and that I really try to make a conscious effort to tap into now. I do feel like this is an important and appropriate place to say that there's a reason that early in my career, and probably for a lot of folks listening right now, why we are doing more CEs that are available and not that we're passionate about seeking out. And obviously there's some privilege and there's some cost that's associated with some of those really fantastic, highly sought after CEUs. And I get that. And I think it's important to name it, because I remember having a few opportunities to do some really cool trainings early on. And that EMDR one I'm talking about was through HAP. And HAP is a provider that brings EMDR specifically to community mental health based programs. So it makes it more accessible. There are a lot of therapists that I see in the community. Thomas Zimmerman, who we will hear from very soon on the podcast, is one of them, where he tries to approach his training offerings in a sliding fee way, where if you're able to pay more, then he invites you to do that. But if you would otherwise not be able to attend the training, then he makes opportunities for you as well, which I admire so much. But I think it is important to just name that there are reasons why sometimes people are pursuing free or low cost CEs. And it's just for the resources of time, finances, et cetera, may not be readily accessible. So I don't want to put it on the clinician for not pursuing those or not being able to access those. I fully acknowledge that. And that is one reason why we're trying to make the CEs available for the podcasts that meet the criteria, free and accessible for those who are interested in pursuing them. Now, I want to bring in some research that I find genuinely moving, because it's not just about CE strategy. It's about what a full clinical career can look like if you stay in relationship with your own development, however that might look. Ronestad and Skolholt conducted what's known now as the Minnesota Study of Therapist and Counselor Development, which is one of the most significant longitudinal research programs on how therapists actually develop across a career. And one of the things that makes this work unusual is that they didn't just look at early career clinicians. They followed therapists across career stages and collected follow-up data from senior therapists averaging age 74. Therapists who had been doing this work for decades. And what they found challenges the assumptions that we might be making, that development is a ladder, that you start as a novice, move through the stages, and eventually arrive somewhere. Their model describes development as cyclical, not linear. It moves through a sequence of challenge, then reflection, then integration, then renewed complexity, and then the cycle begins again, over and over, all through the career. And the drivers of growth at every stage are consistent regardless of career phase. So exposure to difficulty, active reflection, openness to feedback, and what they call avoiding premature closure, which is the illusion that you've arrived and there's nothing fundamentally new left to learn. The therapists in their study who stayed vital and engaged across decades were the ones who kept the cycle going, who kept encountering complexity and sitting with it and integrating it and then encountering it more. I love people like this. I love people that love to learn. And I love that there's almost a humbleness about a person who's interested in starting that learning cycle over and over and over again. Because I think sometimes I don't know where this symptom or feeling comes from, but you almost feel like I'm too seasoned or I've been in the field too long to be a newbie in a room. And that, I mean, it's a cognitive distortion, right? Because that would only be true if there was one room. I mean, it's still not true, but there are thousands of rooms. So you can't go in thousands of doors in your first 5 years in the field and get them out of the way. Like, there are always new doors to go into and new doors opening. So of course you'll be different ages walking in different doors at different parts of the lifespan. So as I've been trying to gather therapists for trainings, consultations, maybe a future mastermind, local networking, I think I'm always impressed with the ones who have been doing the work for a long time and are still motivated to start the cycle, the new cycle of learning and development anew. Because I think for me anyway, that's what keeps me excited and passionate, is that I'm always willing to go in a new door because I'm curious. I want to know what's behind it. Maybe I won't be in that room for the rest of my life, but I want to go in the door. The SPRISTAD international study, which was a large collaborative research project of therapist development, reinforces this as well and states that therapists who stayed engaged in deliberate practice, supervision, and consultation and reflective CEUs reported higher perceived competence and more adaptive professional self-concepts. Not just more knowledge, but a better relationship with their own professional identity. And this is something that I've experienced directly every time I've committed to training in a new framework through to a high level of fidelity, which I tend to do. If I start it, then I tend to follow it through the whole path through advanced training and supervision, because this is just how I am. I like to understand a framework. I like to tell people it's not that I'm a rule follower. It's just that I want to understand the framework of the rules. I just want to know how it all works together. Like, what are you requiring? What are the general behaviors like of people in this space? It's not that I am going to even end up doing them. It's just that I want to know if I'm actively not following a rule, and I want it to be purposeful and not just because I didn't understand the framework. And so there's a shift that happens when you follow something through the complexity, and the work gets more interesting, not less. New questions emerge. Cases that would have felt stuck start to feel like puzzles worth engaging in, at least from my experience. Whether or not I choose to follow that same framework for the duration of my career, I like to know what happens as the cases get more complex through the eyes of that model. And she describes that it's actually less of a career ladder and more of a career spiral. You visit the same fundamental themes at deeper levels of complexity, and that depth is only possible if you stay curious enough to keep engaging with what's hard. The implication for how you approach CEs is significant, and it's not about collecting techniques, it's about staying in the developmental cycle and choosing learning that introduces genuine challenge, creating space to reflect on it, integrating it into your practice, and then being willing to encounter the next level of complexity. So I want to bring this conversation back to burnout prevention specifically, because I think the connection between ongoing learning and burnout protection is one of the most undernamed pieces of this conversation. And overviews of therapist burnout prevention consistently show that skills development improves professional confidence and competence, which in turn are associated with increased job satisfaction and reduced stress. And that's a fairly intuitive connection. But what I think gets underemphasized is the mechanism. It's not just that competence reduces stress, it's that the experience of growing and feeling like you're becoming more capable and more nuanced as a clinician in itself is a protective factor. And there's organizational research cited that finds that structured career growth initiatives can reduce professional turnover by up to 30%. And the protective factor they identify isn't pay or perks necessarily. I mean, let's keep the pay and the perks coming, am I right? But it's the experience of feeling like you are genuinely progressing and your work is taking you somewhere, sometimes just to feel like this is where I am, this is what I study, and I'm going to be here for the duration is what one of the prompting factors that I think may prompt clinicians to leave the field. I think if there's a feeling of stagnation, I think people start to pursue like, well, what do I, after I've gotten my license, like there's a feeling of pursuing up until that point, and then maybe it feels like, well, now I've done all the things, so maybe I pursue a new career. And I think there are other ways to start that cycle again through learning, as we're hearing, rather than needing to leave the career altogether if that's not what you're truly motivated to do. The other thing that I see clinicians do is stop pursuing clinical learning in order to pursue business learning, which I love the business side of it too. I think it's really interesting to learn business and marketing because I think in some ways it all relates back to psychology and the work that we're passionate about. But I think sometimes it can feel like, oh, I'm going to go all in on this path and leave the clinical curiosity behind. But I think they can work synchronously together rather than having to stop one to start the other. And Kashtan's curiosity data connects directly to this as well. The dimension he calls joyous exploration, that engaged exploratory stance toward learning and discovery, is negatively correlated with burnout indices in therapists, which means an exploratory orientation toward your own development isn't just pleasant as much as it is protective. And we talk about burnout prevention almost exclusively in terms of what we do outside of the office, walks, supervision, and boundaries. But there's a compelling case that what happens inside the work matters enormously as well. And the quality of engagement you bring to learning your craft is part of the intervention. Curiosity-driven learning isn't a luxury addition to your wellness plan. It's probably a core component of it for a lot of people who can report that they haven't experienced burnout. And the converging picture from all of this research is that meaningful, curiosity-driven, social, and self-directed learning is associated with higher engagement, greater satisfaction, and lower burnout. And I can attest, I'm a person who, when approaching burnout, often seeks out a new learning path. The direct studies on CE and burnout specifically are still limited, but the indirect evidence across multiple bodies of research, it does appear to be consistent, and it points in one clear direction. The stance you bring to your own learning matters as much as the hours that you log. So here's what I want you to take from today. The research is clear that CEs that transfer are CEs that you have owned by being self-directive, and they're relevant to a real clinical question with space to apply and reflect on it and have support around it. And curiosity is a protective factor, not just a personality trait that some of us have. And you can activate it deliberately by choosing to learn about a topic that engages you. And lifespan research shows that development never stops, and it's more about being cyclical. And staying in the growth spiral is the goal, not trying to arrive somewhere. Before your next license renewal, I'd encourage you to audit what you actually implemented from your last cycle of CEs and explore if there was anything that you learned about or paid for a CE on that you've actually taken with you and applied with your clients, and let that gap tell you something. If there's nothing that you took from last year that you're still actively curious about or applying, then think about, maybe even make a list of the types of questions that you have right now. Think about how you could get those solved, and then start your search of what's out there. Feel free to go through the library of researchers and experts in this podcast to see if anyone who's a subject matter expert recommends an interesting book or training on a topic, to see if you can pursue CEs in that direction. But I think it's just a great place to get started, however, wherever you end up. So head over to lorrainemoorhead.com/podcast to stay in the loop and sign up for the newsletter. And I'll see you next week.